So we're controlling these, right?
No, so you won't want to unmute those. We'll control the.
You're gonna control the mics? You'll control the microphones, just don't unmute the computer part. So
Right.
when you wanna talk, push for green, go ahead and talk.
Right. Test 1, 2, 1, 2, 3.
Test 1, 2, 3.
Press again.
Yeah.
Don't torture people.
And then the second one I have right after that.
The other colorful one. I like color. Which people use color more?
This one?
That one there, right? Yep.
Starting to say, hey, thanks for, Taylor, and starting to go, hey, Patrick turned off.
You look, what happened? You log in, it's like, where am I? I'll put his tag back. All righty.
So we have one caller. Can you please identify yourself so we can note your name for the presentation today?
Except for Chuck just ran upstairs.
And if you're available, everyone calling in should not unmute. All right, I'm going to I have a list of who's on the call. I'm going to read the list so everyone knows who's on so far. And we'll dispose with having everyone answer yes. They're here. So what I have is Allison Titcomb, Amber Smith, who is the chair, Ann Fraley, Audra Winters, Brian Stewart. We have several call-in, user 1, 2, 3, 4, 5, and 7. Carlos Estrada, Clint Maybe, Dave Perry, David Godlewski, Elizabeth Slater, Farhad Mogimi, the vice chair of the committee. Francisco Garcia is on the phone. Fred Ronstadt, Guillermo Gallegos, John Jackson, Kevin Burke, Curtis Dawson, Mark Miller, Matt Siegel, Steve Ponzo, and Mark Clark. Troy Little just joined us, and we have Dustin Williams and Randy Graff in the room, along with the staff. I'll turn this over to Mr. Huckleberry to give us some initial comments, and then our goal will be to hear from you. I'll kind of frame the meeting once he's done.
Thank you, John. My staff reminded me as I was leaving to come to this meeting whether I had my dot and my mask. And so the dot is the same thing most of you went through out in the audience, which is a temperature check. And the mask is obviously a new way of meeting. So it is just where we find ourselves today. This Back to Business Task Force is really all about trying to figure out how to seamlessly interface how we go from where we are today in a stay-at-home order to one that's basically getting back to opening up businesses and activities. We formed 3 basic subcommittees or committees to do this for, really. The Road Recovery Task Force is really dominated by the medical professions, which is really trying to give us the best medical advice and best public health advice as to where we are in the current pandemic and how we are poised to try and start bringing ourselves out of the position that we're in today. It has yet to meet. It'll meet on Friday morning. We have had also expediting government regulation, and the main purpose of that series of committees and subcommittees within it is to have public facilities reopen. How can we permit them to do that, and how can we expedite training? The 3 subgroups of that activity have already met. Bars and restaurants has met, resorts, pools, and spas task force has met, and the attractions task force met yesterday. We've had, and I'll show you how this process is supposed to work and how we'll actually get input from the Business Employees Health and Wellness Group through your chair and vice chair. It is in the Restaurant and Bars Task Force, we offered a whole series of, here's a series of public health options that could help you and assist you in how you open up your business and do it safely to minimize the spread of COVID-19. And they were offered, they made comments on those, they actually suggested others. We then put all of those together, come up with a list, and I think that list is about 17 long, and then we're going back out in another public survey of that list to see what's most acceptable, what's least acceptable, and through that process we were able to narrow down what we think is probably a reasonable series of temporary regulations regarding reopening. Our regulations and where we're structuring them as temporary is simply because we want to offer them as kind of a suggested added guidance. Obviously, and we'll wait and see on the restaurant openings on May the 11th, where the state issues more guidance than they already have. The general guidance they offered is fine, and we use that as a base requirements, and then we offered this other enhanced series of options that basically would reflect what we would call best practices from a public health perspective. And they're suggested, and the ones that would come from the state are required. Ours mirror those, but they offer a little bit of additional guidance and a little more specificity, because I think that's what we've heard from the restaurants is we need to know specifically what you're interested in and specifically what we can do. So that's the process that we're using. We use that same process today. And in your particular group, we have the broad representation of business, from small to large, from the utilities to the educational institutions. And the concept is, again, to hear what you would suggest, what you think should be done, what you think ought to be, quote, best practices that we can offer to provide some level of confidence in the public that they can start to come back out again and do the things that they did before the stay-at-home order was issued by the governor. So with that, that's really about it. I can give you a very quick snapshot update on where we are from COVID-19 case information. On the May 6th, that's today, we now have 1,425 cases. That's 46 more than yesterday. And the number of deaths are up to 116, and that's 11 more than yesterday. When we look back over a time period of about the last 8 days, most of the new cases have been in the, we'll say, a low 20 to 28 to 33 range. 46 is a little higher than we would expect over the last 8 days. But again, a lot of this information lags, and it lags as much as a week, simply because of the day a test is taken to the day you actually get the results. We're actually seeing a fairly significant uptick in actually as reported test. Typically, we've been running in the 200 to 300 per day range, as low as 84 in one particular day on April the 29th to May 6th. There's been a very large increase in test results received, and that's 2397. So you can see that's 10 times what we've seen in the average of about the last 10 days. We don't know if that is a result of the surge testing that was instituted this last Saturday. We know in Pima County our surge testing was only 588 tests. So this could be a combination of surge or just simply reporting of previous deaths catching up in one particular day. So it'll be interesting to see how the number of tests continue to come in the next 2 to 3 days. So with that, John, let me turn it back over to you. And I think our main goal here is to try and get some semblance of order out of the chaos that has occurred with regard to how we've basically reacted to where we are today. And to try and part of the discussions will ultimately be among these various back to business task forces or subcommittees is how often and how long do you want to meet. You may find that you only need to meet once or twice before some of the regulations are opening back up. You might also want to say that you'll meet and we'll issue some reports that talks about the best way and the best approach from a public health perspective. And then have a hiatus for 2 to 3 weeks, and then come back and look at the data with regard to the number of cases and the number of deaths related to COVID-19, just to see what type of adjustments may or may not need to be made in the future to kind of stay on the same course of reopening basically the community. With that, thank you.
All right, thank you very much. We have a very large committee. We have 29 people, 30 now on the line, so we'll need to move through this fairly quickly. As Mr. Huckleberry mentioned, Amber Smith and Farhad Mogimi will be representing this group on the steering committee that meets on Monday. So we'll be compiling your comments and trying to move that, make sure they are well informed for that meeting on Monday. I wanted to reiterate our mission statement, and we modified it a little bit. It's how employers can ensure that employees and customers, I added and customers, are safe and healthy as they return to business. We need your input on how to get these businesses reopened in various industries. You represent a broad range across multiple communities. We have a broad number of communities involved here with a common set of rules and guidance that are safe for the employees, safe for the customers, and safe for the survival of the businesses. It's critical that we not get in the way of businesses surviving this, and we need your input on how we do that. The key thing that I see is that we need to restore customer confidence in our businesses and their ability to ensure that customers are coming back. That goes for the students, for the superintendent of schools. It goes for all of us in the various aspects of our businesses. Your ideas on how to reach these customers and leveraging your membership and how we tie this all together are part of the reason that we selected you to be on this committee. So we would appreciate your ideas and also how we get this message out. Finally, as Chuck mentioned, this is a fluid situation. Things that come out on Monday change Wednesday. And our goal here is to craft how we get the businesses reopened, not when. That will be determined by a totally different set of criteria. So we need your input on that, and we appreciate all your help. So I'm going to call on each of the members as we go through, and if you'll try to be as brief as you can, remembering that we have 30 people online to move forward with comments. Patrick?
John, I just want to suggest maybe we start with the co-chairs.
Yeah, good idea. Amber, why don't we start with you as the chair, and then we'll have Farhad on deck. So Amber Smith.
Good afternoon. Can you hear me?
Yes.
Thank you so much for the invitation to help spearhead this effort. Obviously, as the largest metropolitan chamber, it is really important for our small business members that represent probably about 95% of our membership have those tools and resources in opening up. Most specifically, they are asking us the how. Many of them do not have the level of sophistication or resources to be able to pivot too quickly. So they are turning to us in the county to be able to provide those specific guidelines. So we are happy to put that together. And the number one thing that we have consistently heard over these past few weeks is the need for consistency across jurisdictional boundaries and what those guidelines look like. And that will be my number one goal, to advocate for that. I'm so proud to see that our chamber partners in Marana and Oro Valley and Green Valley are part of this conversation so that we can achieve that. And we will continue to engage our members that do have that level of sophistication with ideas and national and global resources on how we can safely open up and really provide that level of assurance to those employees and the patrons that their safety is number one on mind, and then second, the ability to be able to do business. So thank you, John. Really, we're looking for that consistent message.
Okay, Farhad? Farhad, you're on deck, and then we'll follow up with Allison Titcomb. So Farhad.
Yes, hello, thank you so much, and I want to echo Amber's comments. Obviously, we were hearing from a lot of partners throughout the region, and the feedback has been very positive. We appreciate the county taking the leadership, and given that this is both public health and economic issue, I think the county is definitely the appropriate organization to take the lead and bring everybody together. So we appreciate you guys doing that, and look forward to everybody's participation. The one comment that I'm hearing quite often from everybody is obviously on what guidelines are out there and who's using what guidelines that are already out there. I just want to put that out there as food for thought. OSHA has done a wonderful job of preparing some documents. They have some videos, and if anything else, I want this group to start looking at some of the documents that are out there, and we definitely want to utilize what's already been created. And I would recommend OSHA as one of the lead agencies that is hopefully going to be a really good asset for this committee to consider. Thank you.
Thank you, Farhad. I might point out that we have posted a number of the guidances and regulations from both the CDC and OSHA on this subcommittee website. So if you, we did not send, because there were so many, we did not send them out to all of the members, but they are posted. So, Allison, I'm going to call on you next, and then I'm going to call on the folks that are in the house here. So Allison Titcomb.
Okay. This is Allison Titcomb from United Way of Tucson and Southern Arizona. Thank you. Yes, echoing the appreciation for the county taking this task on. And one of the things that we wanted to share back in particular was related to, United Way is involved with a lot of these different groups and organizations around the community, so certainly we're going to be interested in helping share the message out. But also the particular issue related to childcare and how for employees to be able to go back to work, that childcare is going to need to play into that. And right now, for example, the Arizona Department of Health Services childcare licensing did a survey, and it's reported that 73% of licensed childcare centers and homes statewide right now are in fact closed. And in Tucson, from the Child Care Resource and Referral Program at Child and Family Resources, they've done also a survey of their groups, and 50% of the child care centers and 45% of family child care is currently closed in Tucson. And so they are, to reopen, they have to meet a variety of CDC guidelines, and some of the things that are being recommended for them include some distancing and small numbers that might not necessarily make it feasible for them to be able to run their businesses. So that's just something to keep in mind. Thank you.
Thank you, Allison. Chuck had a question. Do you want to articulate that?
Yeah, and this really is probably for Amber. And one of the common themes that we've heard with the hotels and resorts, and even I think some of the restaurants, was the availability of what we call PP&E, or personal protective equipment. And we would, be thinking about whether or not that has been an issue raised by your members, particularly small businesses, because they may not have access to those things. And one of the things I think we would want to be able to do is try and help facilitate that access if we can even get it ourselves. So that's an issue.
Okay, thank you very much. Troy Little, would you give us your ideas? Thank you.
Push the button.
Can you hear me? There we go. I'm just very appreciative to being invited on this subcommittee. I hope to learn as much as I can help. I'm very interested in doing what we can to get our community back rolling again. I think that we need to make mitigated steps, but every step that we take is going to be beneficial for our community. But again, I'm here as much to learn as I am to help. Again, thank you very much.
Okay, thank you very much. We have Dustin Williams.
Dustin Williams, Pima County School Superintendent. Pleasure to be here, honor to be here actually, and glad schools are invited. Obviously, I'll kind of just give you the rundown. Schools have been closed by the governor and will remain closed, but they're not technically closed because we're still open for remote learning. And what remote learning means is basically any child that has any type of infrastructure for technology can remote into the school with their teacher, and their teacher is usually at home, sometimes at the school, and they will conduct lessons on a daily basis. What that looks like for each household is a very, very unique situation. We think the number is somewhere between 10 as high as 30% of the entire population of students might not have that connectability or might not have the infrastructures in their house. They might not have the Wi-Fi, the money for the broadband, and the whole line of what technology looks like. Also, the statistics of remote learning are not great to just begin with. Graduation rates and online learning tends to not look as good as having children in the schools. So top priorities for schools obviously right now are closing out this year and graduating this really unique class of 2020 students, from high school seniors all the way down to kindergartners. And a lot of families take this really, really seriously. So we see our first need from the community as however you can celebrate the 2020 class and be vocal on social media platforms and to people you know. That's our first need. Next is, with the working environment, a lot of these families have children, and for them to be successful when they go to work, there's usually a place for the student to go. Well, when you take that away, then you have a twofold problem. You have one, what do we do with the child and make sure that they're getting the best education, the social emotional needs, and when we talk about social emotional, we can go into a whole area of that, which is domestic violence and everything that you can look at that could be bad and harmful for a child that we can't see right now. So that is top priority, safety of the child. And then second is, how do we get the parents back in the workforce as we open when they still have 2-3 kiddos at home, and as we just heard, the statistics for child care facilities are closed. So a lot of this also deals with the Arizona Department of Education and the state legislature and funding models of how schools are funded. So we do see this as an opening gateway for schools to have this partnership with the county for us to really identify stronger needs as we go forward. Schools will obviously, again, be grappling with everything they can do to close out this year, and then what would summer school start to look like. And we've already got pushback as far as what will that funding even look like at Arizona Department of Education when the requirement statute-wise is you need seat time for that to happen. So the same things that we saw to close out the year will definitely be happening in the summer. And then the big grand question is it's obviously easy to close. We can see that you can close schools, but how do you open schools? Especially with so many stakeholders that are involved, from parapros to librarians to nurses to principals to admin to janitors to cafeteria staff. And so the idea that we're starting to think of is to bring the confidence to the community is, what if the perception is schools are the absolute cleanest and safest environment you could possibly step into? And so some of the superintendents had said, what if we had a partnership with county health where we could bring in the rapid COVID testing with the partnership with the U of A and test all of the people that are on campus so that parents could feel safe that every employee has been tested and is healthy. That could be some things to start to look forward to. Obviously, Mr. Huckleberry, the PPE, you're 100% right. If, it was interesting as schools were trying to do their school, and then the health department said, Dustin, we need some help with the 3D printers make face shields, and we turned around and on a dime, school started, making hundreds of face shields for the first responders, which was just an incredible partnership. So to see that momentum and that ability to do that, and since then, we have stepped away from the face shields. But leftover uses of PPE, schools donated everything they had. We would really need all of that back and triple fold so that if we do indeed see a rebound, which God forbid, we're all hoping we won't, but if we do, we know that we can say in our back pocket, the schools are going to be extremely safe, and we're going to make sure that the students are protected and are as safe as possible. That's going to put a lot of confidence in the parent, because we just have so many of them right now that really wouldn't send their child to school even if they wanted, if schools were to open, you'd have at least 50%, and not just students. There's also a big demographic of teachers, and in some of those demographics, those are some people that are at risk for the COVID. So those would be probably the big things for us to think about. Again, with this partnership that we're developing now, we can take this further, we can get these detailed, we can have more intimate conversations with the superintendents and their leaders. And then lastly is, how do you just maintain the education infrastructure regardless with COVID? And we see that as remote-based learning. And to do that, how are we going to solve that the issue of, how do you have a computer for every child, and then how do you have Wi-Fi, and then how do you get the cost to where it could basically be free? And we mean full-on access for every single family. And so those are probably the big takeaways I have. Budgets with Proposition 301 and sales tax. We're going to see all that unfold in probably the late May to early June, as far as what the JLBC has said is what budgets are going to look like. And we've all obviously heard that the state's looking at a $600 to $1.6 billion shortfall, so schools get really, really scared when state cuts money, because typically they have always come for educational funding, and those are the big areas that I think that we could focus on right now and going forward. Thank you.
All right, thank you very much. I see Amber has a question. Amber, would you raise your question?
Clear.
You're on.
Sorry, that was from earlier. But to address Mr. Huckleberry's comment, PPE is a concern for restaurants. We have been trying to identify who is making large purchases and orders so that we can communicate that. But it's even beyond PPE. It's also really any of the vendors as far as the restaurants to try to gain some economies of scale.
You want to say something?
Good. I think, what we need to do, we've got a program in our COVID-19 webpage. It talks about Survey 123, and we'd like to get everybody acquainted with it, get registered so we have an idea of economies of scale. We just purchased, and I think we put the order in about April the 1st, and I think we just received 2 days ago 500,000 masks. And so that's the kind of scale that we purchase in. So we can do that and I believe probably distribute it appropriately to those who need it, particularly those who may not have been accustomed to buying those things in the past. So that's helpful.
Okay, thank you very much. Randy Graff, you're up, and Ann Fraley, you're on deck. So Randy.
Yeah, thank you. Randy Graff, Green Valley Street Chamber of Commerce. Certainly, once again, appreciate the invitation to be involved in this. As has been mentioned already, one of the big issues, I mean, the business community, particularly the small business community, has been hit very hard by this whole situation. The top down, basically telling businesses you're shut down for as much as 6 weeks now, and finally getting to be reopened has been difficult. If all things had gone the way they had originally been touted through the federal government with the Paycheck Protection Program, it might have given some relief, but at this stage in the game, surveys of our members, only about 40% of them that had applied had gotten funding through the PPP program. So it's left a lot of them in the cold and in difficult situations. So I am glad to see that we are starting to open things up. Obviously, a lot of businesses too, like has been mentioned, has not been in the market for PPEs. So that is one of the things that we've been researching and trying to find suppliers. We do have a lot of members in the Green Valley area that are in the healthcare industry with assisted living and that. So a lot of our members do have access to some of that, have had suppliers, so we are in the process of trying to find that and share that information with our members. The guidance coming out of the state of Arizona, guidance for retail, guidance for bars and restaurants, guidance for salons and barbershops and whatnot, I think is a good place to start getting that information out to our members and anything we can share with them. I'm interested, though, my thought process is that, just like Dustin had mentioned, the schools need to, the parents need to know that the schools are safe for their kids to go back. Business owners are in the same position. Customers are going to have to feel comfortable for them to be successful. No different than opening a business today. I've got to prove that I've got a product they want and that we can get it to them in a good manner. So I'm hoping that we don't see this as a top-down approach to mandating things on the business community, that we give them recommendations, and those that, and I think the vast majority, if not every one of our members, will be certainly interested in trying to make sure that it's safe for their customers and their patrons, and it's going to be the new requirement. So I'm hoping that we can rely on the business owners and the entrepreneurs to do this properly and look at them as the experts in how they can best provide the services and goods to their patrons. So it's not a top-down approach.
Thank you very much. Ann Fraley, you're up, and Audra Winters, you're on deck.
Hi, everyone, and thanks for forming the subcommittee. We really appreciate it. I'm Ann Fraley with Southern New Hampshire University. And our situation is a little bit unique. So we have about 150 employees now, and we've all been working remote as of March 15th. We took our entire team, even our new hires, remotely. And actually, in the month of April and in May, we brought on new employees. So like currently, starting Monday, we hired 22 additional people here in Tucson. Kind of our way of supporting and helping the community. There's so many people who are looking for employment right now. It was really fortunate that we could hire 22 full-time positions, and we are bringing those people on completely virtual because our office is closed right now. So we adjusted a lot. We made a lot of accommodations and made sure that we supplied them with all the equipment they needed to onboard with us successfully virtually. And in the month of June, we're going to bring on 8 to 10 more individuals to support our students. We've been seeing a lot of interest in SNHU, being that we're an online university. There's definitely a need for our services right now, even more than ever. But we're really empathetic to the whole community, and we want to always do our part. So a return to work for us is unsure when we'll go back to the building. We're going to look for guidelines on what the county's doing, what Tucson is doing, and we'll follow those. We also have a COVID task force at SNHU in Manchester. We're looking at safe business practices and way to bring people back into the office safely. We do think it's not going to be a return to work with everybody immediately. It'll be a phased approach. Some of the questions that, we'll be looking for answers for and help hopefully support is what everybody said, childcare. So we have a lot of employees who have kids out of school, out of childcare, and for them to come back to work, they need a solution for that. Testing, just wider testing and access to testing, I think is one of the other problems we have to solve for. And then I think PPE, we're pretty good. I think we bought, in partnership with Manchester, so we're in good shape. It's just the guidelines that everyone else is following that we follow, that employees really feel safe. I think as we talk to our teams, there's a lot of uncertainty here and a lot of nervousness about going back to an office where there's a lot of bodies, rightfully so. Thank you. Thank you so much for having us.
All right, thank you very much. Mr. Huckleberry has a question.
Yeah, I have a question both for Randy and for Troy. And Randy, I think we've been trying to get some factual, and this is probably for all the other chambers as well, information on PPP. And so 40% applied. Next question, what percent was successful and what's been their experience and that type of thing. So you don't have to answer now, but I mean, we would like that information so we can follow up. Because we think there's probably a lot of follow-up that's needed at this point, based on just what we heard about the program. And Troy, you operate a business where you have a lot of different locations throughout the community, and you staff them with, I don't know, anywhere from probably 2 to 5 or 6 employees. And then you have various vendors coming in the facility at all the time. So couple of questions, and this is what we then talked a little bit to the restaurant folks about, is your employees, would they feel comfortable wearing a mask? Would they feel comfortable if they did the same thing that we do here, have our temperature taken just to make sure that you're within the range? And the same thing with the vendors, or would that put too much of a burden and probably not be beneficial? So that's kind of a question, because we know you have a lot of different employees in different locations and different shifts, and how would that work for you?
Troy?
To answer your question, PPP is more available. It is expensive. But we have been able to find it. Originally, when all this started, it was very difficult to find. We were only able to really acquire gloves. Since that time, we have rolled out masks in limited supply. We have in our stores placed the face shields that separate the customer and the clerk, and quite frankly, that did as much to provide a sense of safety as much as anything. We have not mandated that our employees wear gloves or masks, but we have provided them. As far as the attitude of our employees, it ranges from very frightened to not concerned much at all. Our vendor community has limited the number of visits to our stores, whether it be deliveries or pre-sales. But we've been in very good contact with our vendors. A lot of the ordering is being taken place telephonically. This last 6 or 8 weeks only seems like it's been 5 years, but it's really been a roller coaster of emotions. There's good days and there's bad days. And I know it sounds silly, but since the weather has changed, nice and sunny, there's more good days than there is bad days. We have had, fortunately, no positive COVID tests amongst our company. We have had a couple of scares, And obviously, that creates a panic amongst the group. For a while there at the beginning, and well, it's still to this day, disinfectants are still a problem. Fortunately, we were well stocked at the beginning, and that has taken us through this point. But as much as anything, that has been the biggest concern, is the amount of disinfectants. In fact, we've had to close most of our public restrooms just for the fact that we did not have enough disinfectants to keep those clean, as well as our point of sales. I hope I answered your questions.
Yeah, you did. And what we see is that the masks that are worn by servers are basically to give the patrons kind of the reassurance that they're safe. And so it might be the same thing with clerks. It's not, it will help them, obviously, to prevent exposure, but your shields do basically the same thing. And as you say, in your business, it adds security. And so it's, when the restaurant group is, it was pretty much unanimous that all the servers would wear a mask, but not gloves, but in between servings, they would be required to disinfect their hands, either wash their hands or use disinfectant. Temperatures, we got a lot of pushback on taking the temperatures of the patron. Some thought that might get them physically harmed, and so that's not a good idea. But in our case, where we're a very large employer, we are probably doing 3,600 a day, and it gives the employees a sense of security that they're not sitting next to someone who could be infected. So my guess is, in your case, the temperature issue is probably not relevant at all, because you have such few employees in a given location.
Along that same line, we have Carlos Estrada on the call also. Carlos, if you're there, can you come on and address the question? Any suggestions you have?
Yes. First off, thanks for including me into this subcommittee. I feel honored. I'm going to kind of echo Troy. Me and Troy have talked and worked together in the past. Some of the same things. I have 1,400 employees in Pima County. Every day is wondering whether or not we get a call. We've been blessed. We've not yet had a positive employee. We've had near misses every single day. So someone who knows someone is affecting every one of my employees' lives out there in some aspect. They feel blessed overall that they're working as for essential business. I'll give you real quickly some of the things that are the most successful and made the employees feel good, and also the customers. The social distancing, the tape, the visuals of the tape, and you can actually see people just stand on those lines until the next person comes up. So I've already read through I like what the Green Valley Chamber said, Saw Arena Chamber of Commerce said, that the guidance is the best way to approach any business. And you'll find out as business owners, they're going to do what's best for their employees and their customers at all costs, because it's going to be their survival of their business and how they react to this. So I'd like to keep it as a guidance and a recommendation, but the best recommendation was the social distancing. The plexiglass was a real good feeling, not only for the employees, but also the customers. We did that. The increased cleaning of having a set schedule of every 4 hours, disinfecting handles and pin pads and door frames and counters, anything that basically is touched. Making sure you have the right chemicals. We found out the degreaser that we had did not kill COVID-19. So it was a learning lesson through our process to make sure we have the right chemicals or disinfectant when we're doing our periodical cleaning. The employees and the customers both like the sanitizers. We offer sanitizers at one point at the gas pumps. Unfortunately, most of those have disappeared by now. But now as you walk in the door, there's a sanitizer available for the customer. It makes them feel very nice to be able to hit it when they come in and then hit it before they go out again. Employees were given that first and foremost, and like what Troy had said, initially we had the supplies, they ran out quickly. We ran into the same problem with our restrooms. We couldn't even get toilet paper, and so we had to shut restrooms down because we had to have a restroom for our employees to use. So we suffered the exact same thing, and every retailer out there, whether it be a convenience store or a Safeway or a Fry's, I've talked to all of them, they ran into the same issues as far as trying to offer the very basic services of like restrooms and to our customers, but without the proper supplies or disinfectants, we cannot do that. All our food prep, oh, by the way, I had a note here that said, so we took a survey and 60% of my employees absolutely hate wearing the masks. But we do require anybody that does fresh food prep, that has any fresh food prep in our made-to-goes or handling our donuts or our hot dogs or any of that, they wear masks and gloves when handling the food. And that's, again, a best practice or recommendation. But for the most part, it would be extremely hard to take temperatures, to your question there, of our employees. We average about probably 7 or 8 employees per store, so there's no more than usually 2 or 3 per shift. But the social distancing, I think people have such a comfort level. My biggest problem is not customers keeping them socially distanced, but my employees, and that was a huge learning lesson. So I love all the recommendations, and hopefully that answers some of your questions.
Thank you, Carlos. Audra, we're back to you finally, and Brian Stewart, you're on deck.
Well, good afternoon, everyone. Thank you so much for having me. Audra Winters with the Marana Chamber of Commerce. Going through a lot of the same things that everyone's already mentioned on the phone. I think all the businesses are so excited that we're slowly going to be starting to open. The main thing that we keep telling them is make sure that they're following the guidelines. So it was great to go through a lot of the accounting stuff that I was unaware of. So thank you for providing that. I think being consistent on what we're sharing with our members and the businesses is going to be huge. And I think the lessons that were just talked about from our convenience store owners are huge. So, and what we learned from the grocery store. So if everyone just is patient with each other and we're out there and we're practicing those, and that's just a consistent message, whether it's, when you're at the park, where you're, at a restaurant, whatever, it's just being consistent all across the county is what I think is going to be important. Again, going back to the PPE equipment, I hear it all the time. I get daily emails and phone calls of, first it was just the medical field, now it's going to be like salons and restaurants, and so that's huge.
All right.
Thank you.
Is that it? Any more?
That's all. Thank you.
Okay, thank you very much. Brian Stewart, you're up, and Clint, maybe you're on deck.
Yes, thank you for having us. I'm representing Chancellor Lee Lambert from Pima Community College. So the college currently has a task force that has been working on our planning for when we can reopen based upon the recommendations from the state. It follows all of the county, state, federal guidelines. It's pretty massive if you're looking for any type of in detailed discussions about that. Physically, we are closed. We have been. We are virtual and online courses only like the other colleges and universities. We are looking at a phased-in approach. Certainly our biggest issue, and the one that we really want to support our community on, is we have a lot of career and technical areas, specifically in the emergency medicine and those type of fields, and they have to have hands-on training. So as soon as we can get them on site, that is what our focus is currently. PPE, we've been pretty good. We've given some out, but we've held some back. But we certainly know as we progress, that's going to become more of an issue and concern for us. And a lot of us are looking towards next year and the impact in general in terms of what we can expect from our students and what we can expect them to do and how we can provide services. Our needs are really data. So as much as you guys are sharing and all the data that we can get, that is what we need the most, because that helps us with all of our projections and our analysis. What we really want to focus on is what we can provide. So any collaborations that you need in terms of providing training, helping people understand what's going on. We have a wide variety of health professionals. Some of them work in public health. And so we have a lot of expertise that we're willing to work with anybody who needs that in sharing those areas. And certainly we want to spread the messages, and we can communicate those out as well. And then we're here for any questions. So thank you very much for inviting us.
We have a question from Dustin Hoffman. Dustin Hoffman.
He's
Sorry,
my brother.
Dustin
He's my
Williams.
brother, don't worry. We social distance quite often, too. Dustin Williams here, Pima County School Superintendent. One of the discussions obviously is if the colleges are coming back, and that would mean that possibly that the K-12 system could come back. What sort of discussions have you had with your social distancing as far as what classrooms will look like? And in particular, what would a classroom of 25 to 35 kids look like in a K-12 setting or a Pima Community College atmosphere?
Question. Excellent question. We will not be having large classrooms like that. So everything that we will be doing, at least for this upcoming year, is going to be either in an online, what we call a hybrid format. So our class sizes will depend upon the square footage of a room, but we're going to try to keep all the social distancing in those classrooms. So typically, you might have a class of 20, we'll have 10 students instead, physically located, and we will be having them come one day a week and a different group of 10 coming a different way of week. I think generally that is what most of the colleges and universities are looking at least of right now, right? Certainly as we get more information and things might change, we could readjust that. But in general, that's how that would work. In terms of the school district, that is a harder thing, right? Because you don't have the space, right? We have that space to spread out in those ways. But if there is a way to sort of create that sort of, not everybody's always coming all the time. That is one way to create that social distancing opportunity, and that's really what we're finding the most effective. And then we're using various types of training a lot of our faculty on the methodologies of teaching in that environment, and we can certainly work with you guys on expanding some of that. I know that's an issue I'm with the TREC organization, and it's one of the things we're working on with you guys.
Thank you.
All right, thank you very much. Clint, maybe he's up. He's on a very short leash. I'm sorry, Clint, I didn't see your email. You're up now. Are you available?
Yes, I am. Thank you very much, John, for having me on. Thank you for inviting me to the panel. Yeah, I'll be brief. I just want to echo what Allison said at the beginning on the importance of childcare to the entire system, and what I'm hearing from people not willing to go back to work until they feel safe with a place that they can have their kids. And just the devastating effect this has had on the child care system. So making sure that that's a precursor to opening up. The second would be more what I'm hearing from nonprofits on the consumer behavior front and how to open. That's whether you're ATC, Tucson Museum of Art, how and when are people going to be safe coming back? What guidelines do they have to be able to come back? What do they do about their upcoming seasons? All those kind of questions that those entities are having. And that would also include if you happen to be in the shelter business. Certain shelters are doing well, others, people aren't feeling comfortable coming into shelters. What are those procedures for shelters and other people that are in housing situations where they are cramped, where there are 2 or 3 people within that 6-foot basis. So just what of them, what do they do to be able to get the capacity back and make people feel safe? And that's it, John.
Okay, thank you. Dave Perry, you're up with David Godlewski on deck. Dave, you're on.
Thank you. Can everybody hear me out there?
Yes.
Thank you. Dave Perry with the Oro Valley Chamber. I appreciate the invitation and your time today. I've heard a lot of good things already and don't want to be repetitive. Interesting observation yesterday from a major employer in our community, a sophisticated guy who said he's actually got too much information. He's got so many different guidelines coming at him, and I might suggest that we try to refine what those are. And to echo several other people, it's good to be authoritative, but I think that they need to be recommendations, not mandates. But simplifying the flow of information to business people, I think, would be valuable. Consumer confidence is paramount, and I've become intrigued by this idea of some sort of a pledge, something that's posted digitally in windows that says, welcome back, and we value your business, we value you as your health, we value the health of our employees, and here are the things that we're doing to ensure that you're going to be healthy and that our employees are healthy. Just a visual, sort of a symbolic reference, I think, might be valuable. I'm extremely concerned about retailers, restaurants, and others as we come into the summer, as we emerge from this terrible moment and into the slowest time of year. And in Oro Valley, our town has eased its regulation of sign code at some level, and I've asked them today to extend those permissions into the fall at least. And I might suggest that other governments do something similar. You know, my analogy was that if a sign drives one $50 table a night to a restaurant, well, that's $18,000 over the course of a year. And that money means something to everyone, especially in this moment. I do echo the concerns about PPE and the availability of sanitizer. You know, I'm trying to reopen our office on the 18th, and I've assigned one of our people to say, your job is to go get all that stuff, wipes and toilet paper and sanitary products, and it's a challenge. So whatever we can do in that regard. Finally, as I talk about summer, I did suggest this to the ACA. I said, we've got to ramp up some advertising in our community and in our state that gives the 40%, you've probably heard the 40% who are undecided about whether they're going to get back out there and do business. We've got to invite them out, and we've got to give them assurance and say, hey, we're open for business. We're completely respectful of your health concerns, and come on out and help us, because it's a long way to October, and I sure want to see us get there as whole and healthy as we can. Thank you all so much for your time and for your service.
Hey, thanks, Dave. Chuck has a comment?
Dave, just a couple of comments. One is, I think, yes, you're right, sign codes and other regulatory things need to be relaxed if they can. So any suggestions coming from the chambers of the business community with regard to what we could relax during this start back into business phase would be helpful. One of the things that we have suggested and we are putting in place right now is a expansion of premises permits, which is simply allowing restaurants and others to expand their area of business under their business permits or their zoning code requirements, so they can help mitigate this issue of physical distancing versus volume of customers. And so you can think about those things as well, and anything that you'd have to suggest, any of the chambers, any of the businesses, we would be glad to look at that.
Okay, thank you. David Godlewski, you're up. Elizabeth Slater is on deck.
Good afternoon, David Godlewski, Southern Arizona Home Builders Association. Certainly appreciate the opportunity to participate in this subcommittee group and try and tackle this important issue. Kudos to Pima County for taking the lead. Thank you to Amber and Farhad for your leadership as chairs of this group. So while it certainly hasn't been business as usual, construction and the related trades have been continuing to operate as essential businesses. Our national association, the National Association of Home Builders, had put out guidelines and kind of templates of safety plans for the builders and their trade partners to initiate. So they've been working under those plans to take appropriate safety measures for, going on 6 or 7 weeks so far, and I believe that has been very effective in trying to maintain some level of business. From what I'm hearing from my members is that they're all certainly eager in getting the economy reopened, but want to exercise caution. It's been mentioned before in terms of just kind of the consistency of the approach and certainty that's provided. They prefer not to see a piecemeal approach, but obviously want to take the steps to help get business back going. We did a survey of our members regarding PPP or EIDL, and we had less than 50 responses, but 50% of the people who responded applied for PPP, 30% received funding, 90% received the full funding. we'll continue to survey and share information. I think that's important to this process. Something maybe a little bit different. You know, I agree that consumer confidence in all of this is paramount. But I also think that it's equally important to remind the public to have respect and appreciation, not only for their kind of neighbor, but also these workers, people who are going to be going back and providing services. In preparing for this meeting today, I was making my calls to members to find out what their thoughts were, and I found it interesting that I had several members who are more in the subcontractor tradesman type of category, who do business with directly with homeowners, and will go out to provide estimates or provide service on individuals' homes. And while all of them are now implementing a program where they're calling or emailing the homeowners in advance to let them know about the safety measures that they've put in place, again, multiple occasions they've shown up and people have said, I'm not doing business with someone who's not going to shake my hand, or you're not coming into my house if you're wearing a mask. And I found that fascinating on one hand, but also very disheartening. I saw on I think it may have been the Saurita newspaper today, the county's digital ad campaign around Be a Hero. And I thought that was a great concept, and I would certainly like to see that expanded, not only, again, just to promote that consumer confidence, but also that, as we get back, and it's just going to be different for all of us to go to restaurants and seeing people wear masks, or having people show up at your home to perform a service wearing a mask, just to be considerate about what they're trying to accomplish, and they certainly don't want to have to take those precautions, but it is a best practice, and so anything that can be done to advance kind of those sentiments from a public standpoint, I think would be welcomed and go a long way.
All right. Thank you very much, David. Elizabeth Slater is up, and Fletcher McCusker is on deck.
Hi, everyone. Thank you. Elizabeth Slater from Youth on Their Own. I'm also in the nonprofit leadership working group that's focused on our COVID-19 response and sharing best practices for the nonprofit sector. So I guess I could speak really briefly just from the perspective of agencies who are serving high-risk populations. Those are our customers, vulnerable individuals who are accessing basic needs. In our case at Yodo, it's homeless youth. And these are folks who may not have access to regular health care, so aren't coming to the table necessarily super healthy or comfortable accessing health care if they're getting sick. So this is certainly a concern for us when we're thinking about bringing our employees back to work. How do we ramp up services again and keep folks safe? We have a workplace safety and cleaning protocols, but really our approach right now is to just try to have the least number of employees present possible to conduct business. But as the restrictions kind of loosen, we expect to have a big wave of clients surging and trying to access services from us. So certainly we share the concerns about having access to PPE, disinfectant supplies, anything that's going to keep people safe. We have absolutely valued the great resources coming from the county. I just want to echo, I think I've heard several people say consistency and also just simplicity of message. I think the nonprofit sector is absolutely hearing guidelines and guidance from lots of sources. The county has been such a consistent, great resource for us, but I think simplifying messages so we understand what we can do to meet the high needs of the community, but really care about our employees and make sure that they're protected when they're delivering these services. That's our top priority.
All right, thank you very much. Fletcher, you're up. Fred Ronstadt, you're on deck.
Good afternoon, everyone. Thanks, John and Chuck.
Can you speak up? Can you speak up a little more, Fletcher, please?
Sure, let me turn my mic up. I can do that. Okay.
We heard that.
You can hear me now?
Much better. Thank you very much.
All right, so good afternoon. With 1,100 merchants in the district, a conversation we hear a lot that I haven't heard anybody talk about is the whole issue around testing. Will the state require our employees to be tested? Will the county? Will the health department? Is there a resource to scale for this, and who's going to pay for it? So, Chuck, if maybe you want to comment on the whole issue of testing.
Sure. When we, I think ideally we'd like to be able to provide tests to everyone before they get back to work. Our problem is that testing still, despite what you hear, is very limited. And so we're getting better at it. We're getting more ramped up, but I think we're still probably several weeks away from having adequate testing to where we can start to look at testing groups of people before they go back to work. And part of the problem is even in the active viral testing, the results take anywhere from 2 to 5 days, and so that's a problem. Antibody testing, may be the answer, but that's under a current study with the university.
Anything else, Fletcher?
Thank you. No, that's good.
Okay, thank you very much. Fred Ronstadt, you're up, and go ahead, Fred. I'll figure out who's next.
Okay, thanks. This is Fred Ronstadt with the 4th Avenue Merchants Association. I just want to echo my gratitude for being included in this committee. A lot of stuff's been said, and I want to go all the way back to what Amber opened up with, and I think that one of the most important things that we need to have is consistency across the jurisdictions, and I'm going to be bold enough to say consistency across all the political jurisdictions. It's my personal opinion, and I think it's shared, that Pima County is and ought to be the regional health authority. There needs to be one central information hub because, as other people have indicated, there is a lot of information coming at all of our merchants, all of our, the population, the community. And I think we need to have just one place where we can refer people to get credible, accurate information that the community has collaborated on and agreed to. And I think the county is that, should be that hub and needs to take that. So I think there's going to be potentially some challenges. I don't know if it's political or if, Chuck can work with the city manager and town managers to really make that happen. In terms of protocols, I think broadly speaking, they're all going to be the same. Certainly there's going to be differences specific to the industries, and I don't think there ought to be a whole lot of controversy about what the protocols ought to be. People should be wearing masks and the social distancing and access to sanitizer and all those other things. But I think that for me and my merchants, the biggest issue is having a recognized authority where people can get information quickly and accurately. And I think that's the county. And I think, first of all, thanks, Chuck, for putting this together. But I think that, we all need to do whatever we can to make sure that people recognize that there is a central hub. It's the county, and they're the ones who are responsible for providing health information for the community.
Fred, I agree with you 100% because I get, as you know, a few emails from time to time, and they come from mostly the federal government agencies, FEMA and the rest, and they're all telling me how many kits I have available, how much PPE I have available, all of which is pure imagination at this point in time. And so I think you're correct, and we've been trying to provide that level of consistent communication from a public health perspective. We will continue to do that. I'm on a call at least twice a week, sometimes 3 times a week with all the city managers, and so I think we're all on the same page. And typically I'm on a call with all the mayors almost 4 to 5 times a week. And same issue is we will continue to provide all of the facts as we know them to exist at the time we're going to tell you about them. And because the situation is so fluid, it changes, and like I said, we know that as we read the FEMA bulletins that come out where they talk about Operation Air Bridge, and that we're all going to have, 1.5 million N95 masks. Apparently, that's still grounded somewhere in China. And obviously, FEMA nationally, they divide up the resources according to state priorities. And at this point, we're typically a few weeks out. But I think we hear your suggestion about common messages.
Any follow-up, Fred?
No, I just appreciate your leadership in this, and I think to me the most important thing is just having a consistent single source of information.
Okay, Guillermo Gallegos is up now with Isabel Georgelos on deck. Guillermo, you're on. You still there, Guillermo? Okay, let's move on to Isabel Georgelos. Guillermo, we'll try on you. We'll try you again later. So, Isabel, you're up.
Hello, can you hear me?
We hear you. Speak up a little bit more, please.
Okay. All right, thank you. First of all, thank you for the invitation. Can you still hear me? Okay, thank you for the invitation to be part of this committee. Again, I think everyone's shared some very specific things, and I have to reassert that probably the biggest thing is consistency in guidelines and messaging. Up to now, I think everybody's trying to get information out to serve our members and community, but I think this is the time for alignment, and this is a great start. So thank you, and that's all I've got to share right now.
All right, Kathleen Erickson. Guillermo, are you back? Can you hear us? Guillermo? Okay, Kathleen Erickson, you're up, and Curtis Dawson is on deck. Kathleen.
Hello, this is Kathleen Erickson with the Downtown Tucson Partnership. Can you hear me okay?
Yes, thank you.
Okay, wonderful. Thank you. So in addition to downtown businesses not feeling comfortable about opening right now this week, they're scared with health and safety concerns. Also, the customers, I think, is another thing to consider. How are we going to make customers feel safe and return to downtown? One of the things that we're going to be doing is planning carefully crafting messaging and a marketing campaign to ensure that people feel more safe coming downtown, and giving people access to the face masks and hand sanitizer would be greatly appreciated if the county could help provide that for our clean and safe team. We could hand those out to visitors as they come to the downtown, or if you could help for us to get connected with that PPE material. Also, continuing to promote pickup zones, I think, is going to be critical to ensuring people feel more comfortable and come back downtown, continuing the relaxed parking enforcement, and then also coming up with some creative ways to add additional outdoor seating for restaurants. Because of the social distancing and the reduced number of people that are allowed inside restaurants, I think outdoor cafes, and if we could craft some type of outdoor cafe incentive program where we could use a park lot in front of, or a parking space in front of the restaurant that might not normally have the space. I don't think that the parking is in as high a demand as it used to be. So outdoor cafes providing the masks, and then also utilizing our community safety team as ambassadors in the downtown to help people feel safe, to suggest that people spread out if they are congregating, and to work collaboratively with the Tucson Police Department to enforce the social distancing. Thank you.
All right, thank you very much. Curtis, Dawson, you're up, and Mark Miller is on deck.
Good afternoon, everyone. Thank you for having me on here. Curtis Dawson with the YMCA of Southern Arizona. We've been providing emergency childcare since March 19th. As was said earlier, that is not a good business decision, but it is a need in the community, so that's why we've been doing it. When you have groups of no more than 10, including staff, it's hard to make that pencil out. So until that number changes, I mean, honestly, it's going to be difficult for child care centers to really open back up. You know, we're serving over 200 kids a week right now. Normally, when it gets summertime, we're serving 800 to 1,000 kids, so we will not be able to do that until, you know, the CDC changes that number. We're right now going through and creating our phased approach reopening plan. We definitely will not be able to get back to business as usual until a lot of pieces change. And we won't be having group exercise, no showers, no locker rooms, a lot of those elements. But a lot of this for me really comes down to the imagery that people see when they walk into our buildings and the actions they see our staff taking. The sooner that we can create that sense of safety for our members when they're walking in the building, or our patrons into our restaurants, the sooner that consumer confidence is going to build, and the sooner we can start getting somewhat back to normal. Reiterate the same things, the cleaning supplies, the hand sanitizer, you know, we've been cleaning as much as we possibly can this whole time, and it's been sometimes difficult to get supplies. I think as we move forward, going slowly is the key, even though I don't want us to do that, because we don't want, and I don't think anybody on this call wants their location to be the new hot spot in Pima County, so we have to make sure that we are slow and careful, but taking the right steps and making sure that we have that consistent message across Pima County. And I like what Dave Perry said. I would love for our community to have a pledge from the business community, with a piece of that that's a pledge from the customers, so that we're all in this together, and there's things that the business community is going to commit to, and there's items that the customers and the members are going to commit to as well, so that we can have that community-wide commitment to keeping each other safe.
All right, thank you very much. Mark Miller, you're up. Matt Siegel, you're on deck.
Yeah, this is Mark Miller. Again, thank you for the invitation. I am one of the District 1 appointees to the Small Business Commission, and as the Small Business Commission was allowed one delegate to this Back to Business Task Force, I'm glad to be representing the Small Business Commission in my district in that role. I'm the owner of a small tax accounting firm in Catalina. And so the comments I would have to make is kind of echoing a few of the comments that have already been made today. I think a consistent guidelines for businesses in Pima County is going to be very important to allow both the businesses and our clients and customers to feel comfortable and to be able to transact business in the county. and also the small businesses, the really small businesses that have been extremely impacted by the COVID shutdown should have leeway and to be able to modify these guidelines as it pertains to their employees, their business, and their customers. So kind of echoing Randy Graff's comment about a bottom-up approach, I think that we should definitely allow the small businesses input into the process. Thank you again.
Okay, thank you very much, Matt. All right, Matt Siegel, you're up, and Steve Ponzo, you're on deck.
Can you guys hear me?
Yes.
Okay, well, first of all, again, thank you, to be part of this, and Amber and Farhad, thank you for your participation sharing this. My name is Matt Siegel. I'm the Managing Director of CBRE. We're a worldwide commercial real estate firm. We work with, many clients, both locally and nationally, on a lot of the topics that have been discussed so far. And, obviously, in the last, several weeks, the discussion has thankfully turned to how we're going to get back to work. However, it is a evolving and fluid situation, words that we hear way too frequently right now. And, just to share some of the conversations that we're working through internally with our company, and also some of the guidance and, discussions we're having with many of our clients. A lot of it's market to market, a lot of it's industry to industry, and I don't think it's necessarily a cookie cutter approach. I think there are some foundational consistencies, but I think companies and their leadership are going to make decisions somewhat differently based on a lot of different factors. A lot of our reopening strategy kind of falls into three buckets. One of which is community readiness, which has been discussed, and government orders, testing capacity, the virus trajectory, which ultimately is the biggest decision maker in how we go about this, and is there going to be a reemergence or a spike in the virus, and then supply chain availability. The next is employee readiness. Our company, I think most organizations have done the right thing as far as making safety and the health of their employees a top priority, and that's ultimately what we've done and what a lot of clients and companies that we work with have done as well. Obviously, it's been discussed, the staggered approach, taking into account any at-risk employees and their considerations, commuting considerations, and internally as a company. And I mentioned market to market decisions are being made. New York City, some of the higher density places, getting to work is going to be the biggest challenge. We've had calls where in Tucson we're a lot more reliant on the automobile, and that's going to be a positive. Where people work, as far as if there's common area, if there's lobby space, shared bathrooms, those are all part of it. So that factors into how ready the employees are, and then finally how ready the facility is. Social distancing, the cleaning protocols, landlord readiness, signage, and supplies to maintain what is going to be the new normal. And again, this is evolving. We've had a lot of discussions also with some of our retail clients, as I think the pressure to have some sort of loosening nationally, questions such as new occupancy plans and layouts, making sure consumers feel confident in business, and this has been discussed across the board, both our employees, any visitors, regardless of the line of business, making sure that they feel safe and confident, and that there's a clear plan that's been communicated how important that is, and addressing the social distancing policies, and this has been mentioned as well as just having a clear message. Also want to go locally and company-wide across many different business lines. I want to point out how the ability to adapt, embrace technology is going to not only, the companies that are able to survive and the employees that are able to survive during these times, I think is really a precursor to not only getting back to work, but also, thriving and adapting to what will probably, see a lot of, changes in the next, 3 to 5 years and moving forward. And I do want to mention one thing, and it's been mentioned a few times, and not to repeat it too many times, but the importance of the, schools and early learning. I know that's a big factor into getting some of our employees back to work and making them feel comfortable that they can be productive.
All right, thank you, Matt. Steve Ponzo, I'm going to keep you on deck. We've located Guillermo. So, Guillermo Gallegos, you're up.
Hello, can you hear me now? Hello? Yes, okay. So, I apologize about that. It looks like I'm having some trouble with my mic on the computer, but thanks for getting back to me. I serve on the Pima County Small Business Commission, and pleasure to be here. Thank you for having me, allowing me to give my input. I want to thank each and every one of you as well, for the time that you guys are taking out of your day. I know there's plenty of other things we could be doing, so thank you guys for taking your time. I think generally speaking, I know the subcommittees are doing a great job right now of putting together specific guidelines for each industry. I serve on subcommittee for the restaurants and bars. One of the things we talk about a lot on there is just the public perception. How does the public perceive the new guidelines that we're taking, and can they see and feel and touch the precautions that we are all taking together? Because when they can do that, that's going to allow, bring that customer confidence back a lot quicker to come back and establish and patronize our businesses. And generally speaking, I don't think we need to overthink it. It's especially with us in restaurants, wearing masks when you're coming in contact with employees and with customers is a big one, and the constant cleaning and sanitizing, disinfecting of high impact areas, from doorknobs, obviously tables, chairs, sinks and faucets, things of that sort. I think again, I don't think we need to overthink it, but make these some high recommendations. And and again, I know a few people have mentioned this already, but I just want to reiterate the importance of kind of keeping it, the guidelines specific, unified, and consistent, all the way across the board. And as I don't remember who it was that mentioned, but as the Pima can be that resource for everybody, we can just come to have one resource that everybody, just to avoid confusion. There's so many different resources out there available right now. So, if we can have kind of a unified voice, I think that would make things a lot easier for everybody. But that's all I got for now. Thank you.
Thank you very much. Okay, Steve Ponzo, you're up, and Mark Clark is on deck. Steve, are you there? Okay. All right, we'll move on to Mark Clark and come back to Steve. Mark Clark, go ahead.
Good afternoon. I'm Mark Clark from Pima Council on Aging. And I guess I would start off by saying those of us who work in the aging space pretty much have been at work the whole time, providing support and services to folks, to highly vulnerable individuals, either in their home settings or also with limited access coming back out. So we have been seeing people, not very many, frankly, but we've been seeing some people in our East Broadway location all through the whole process. But certainly that issue of in-home support services is a very significant piece, both whether it's delivering home-delivered meals, and there's probably between our Meals on Wheels program, mobile meals, and interfaith community services, I suspect we're delivering something in the vicinity of about 2,000 meals a day to folks. And then we're in the process right now of working with the city and the city of South Tucson as well, looking at how we can expand that home delivered meal program. And then we have 12 subcontracted home care providers that are going into people's homes, actually providing folks, helping people take baths and helping them change their bed linens, maybe do some laundry, those sort of issues. All of those services are provided by trained caregivers. A major issue for us is going to be the workforce issue of how do we recruit and train caregivers. It's interesting, the Red Cross, bless their hearts, now has guidance on how you can teach somebody to do CPR without actually being in the same place with them. So looking at those workforce development issues are major. We, of course, are very concerned about social isolation and loneliness. The health impact of those issues on older adults is huge. And that sort of has brought us to the issue of the digital divide. We talk about that a lot with school-age children and access to education in a non-classroom setting. But when we're offering caregiver support groups online or doing exercise programs, again, online or digitally, or our case managers are calling people at home to check in with them, we're using minutes and data on their data plans. And so that's a major issue that we're continuing to try to explore, doing a lot of advocacy with congressional delegation related to the Federal Communications Commission and trying to expand the amount of call minutes and data volume that exist on Lifeline phones, which are provided to people. So of course the major issues for us are personal protective equipment, and that continues to be a major an issue and a challenge for us. I've got a half-time staff person who's spending a staff person who's spending half her time out looking for PPE. And then, of course, the issue of testing is a huge issue, one that I can't emphasize enough. And finally, I would just express the concern that I heard earlier about the tribalism that I fear is going to develop related to wearing masks and social distancing. And so anything that we can do, I think, as a wider community to try to minimize that, to do those sort of public campaigns around the importance, the fact that we're all in this together, which we see on TV a lot, but those sort of issues, I think maybe some interest in that sort of public exposure of a pledge kind of thing. I'm intrigued by that as well. Because we do all have to be in this, and we don't want our folks who, of course, are wearing masks and gloves and things like that as they interact to be running into people who are thinking that they're making a political statement when, in fact, all they're trying to do is ensure their own safety and the safety of those they're caring for. Thank you.
Thank you very much, Mark. Okay, we're back to Steve Ponzo. Steve, you're up.
All right. Well, good. Well, Steve Ponzo with Washington Federal Commercial Banking. We've been really busy, obviously, dealing with all of the PPP loans. We actually funded, 20 or 30 more here today. So been really, really busy with that. And we've had opportunity during the course of that to talk with literally hundreds and hundreds of local business owners. And there's not a lot that I can add that hasn't already been said. Honestly, the consistency piece is, I think, really important. Business owners what they don't want is, unclear guidelines, and then we end up in a position where they don't know how to implement them. So specificity, I think, would help. Giving people clear, direct guidelines with specificity that is maybe even geared towards different industries, because we've done a ton of PPP loans within the restaurant industry, and there are needs within that industry that are different than the retail, stores that we've worked with. So maybe some some guidelines that are broken out by industry would be helpful with some specificity within those industries. But consistency in terms of the message and the approach, I think, would be really helpful. I think people are looking at all of the different sources and trying to make sense of all the information. And at the end of the day, most of the business owners that I've talked to, they want to do their part. They want to do what's needed to make sure that we don't have a resurgence, a huge second wave that puts them out again. Being that we've done a lot of PPP loans for restaurants, one of the biggest things that I hear is concern over they just lost the best couple of months worth of sales, and now the snowbirds are leaving town, and they're not going to be, they're hitting a point in this summer where it's just going to get worse. So anything that we can do to aid those companies going into what's already a rough season, it's going to be even rougher this summer, that would be good. Giving them access to PPE, that is something I've heard people talk about too, making sure that it's accessible. If there's any type of a county resource or something like that that can help, I think that's a great idea as well.
Thank you very much, Steve. Okay, we're going to the call-in users. Call-in user 2, you're up next. Okay, we're going to call-in user 5. And you're online. Call in.
Sir, I think some of us don't know what our user number is.
I'm sorry, I didn't hear you.
Oh, this is Gabrielle David. I think those of us who called in aren't aware of what our user numbers are.
Okay, well, we've got 2, 5, 7, and 9 on the screen, and unfortunately I don't know either, but you're up, so why don't you talk? And give us your name and who you represent. Okay, can you proceed?
Okay, first of all, thank you so much for the invitation to be part of this. I'm Gabrielle David. I'm editor of the Ajo Copper News over in Ajo on the far western edge of Pima County. I'm also a member of the Small Business Commission for Supervisor District 3. I've listened with interest to many of the concerns and comments, and I share most of them. In the interest of time, I'll just say ditto to all those comments regarding the employee health compliance, educational woes, availability of PPE, consistency, and the need for timely and accurate data. Ajo is a small town, and we're drawing together in typical fashion with support that ranges from financial to food. People are making fabric masks. There's a care network formed to help those in need. A local nonprofit is offering support services. But all that care and support isn't keeping jobs from being lost and businesses from closing. Local kids are struggling. We are a poverty-stricken area, and many of them are finding difficult to get to the school and pick up homework packets. Many of the parents have difficulty in helping their children with this homework. Going forward, information, easily understood, consistent information is vital. I have had some local business owners tell me they're confused by the plethora of information aimed at them. What are the rules and what are recommendations? If someone has a business that combines several types of services or goods, what applies to them? What help is available? And what is real help and what is a scam? And how do they get the information if they are not comfortable with online resources? Believe it or not, we have one local business owner who does not even have an email address. Concerns I have heard expressed here locally, of course, the access to personal protection equipment and sanitation supplies. But they also worry about being in an often forgotten corner of the county that doesn't have easy access to many of the services being offered. Then again, I think a lot of what all of this about, information. Thank you.
Okay, I have a question. Early on, there were some food shortage issues out there. Are your food shortage situation, I'm not hearing you terribly clearly, but are there food shortage issues out there continuing?
Only in a mild form. Ajo CSA coordinated with Tucson Food Bank and other entities, and we've been having food brought in, which is being made available weekly without any income guidelines, which is very helpful because we have a nice part of the population that sits just above all the guidelines. The local grocery store is stocked pretty well now. We had a influx of people from metropolitan areas who heard through Facebook, I think, that our store was well stocked, and there was a heavy enough run of people coming in from out of town that they actually asked the local sheriff's department for help and just maintaining security as they set limits. I shopped yesterday and I could buy just 2 of any frozen item, but there were no limits on produce, and there was toilet paper on the shelves.
Okay, thank you very much. Okay, we're going to go to 20 questions now and try to figure out who the callers are. Let's try caller number 2. You're online. Can you speak? Say again. I'm not hearing.
That's us. We just don't know who number 7 is.
Okay, caller number 7. Can you identify yourself, please? Anybody hearing that? They're on, caller 7 is on TV. Call in user 7. And what about user 9?
That's Guillermo.
Oh, 9 is Guillermo. Okay, so 5 and 7 are the only 2 we don't, or 5 and 2 are the only. Okay, so 7 and 2. Call in user 2, last chance. Anybody?
Sorry, that's us.
Okay, all right. Sorry, guys. All right, so we're trying to figure out who call-in user 7 is. That's the last person. I've been checking names off. There are not many left. Bo Johnson, we already covered the Ajo Chamber. Susan Gray from TEP was going to call in. Is Susan Gray on the line? Okay. Okay. All right, so we'll move on to any comments that we have. Any to either the chair, the vice chair, Amber or Farhad. Do you have questions, comments, things that you'd like to clarify for the group? Amber.
I don't have any questions necessarily, but what I would like is data. We need to best understand how our local businesses have been impacted in these different areas. Today we talked about some significant issues. So 1, what are those consistent guidelines I need to follow when we open? 2 is the safety of my employees. I think that also includes your food security issue, and I think that's a really important thing that we need to make sure to have a solid grasp of. And number 3, childcare. The county already knows that has been something that I have been passionately advocating for, because childcare is a workforce development issue, and there is no better time for us to really see how that relates. And then lastly, how can we help our schools? Because it's all relate as part of that. And so how are we going to break up the goals of our meetings for the future? Those are the 4 areas that I think would be important to focus on.
Thank you, Amber. Farhad, do you have any other comments? Can you unmute Farhad,
Very
please?
productive.
There we go.
I think the comments were very productive. Appreciate everybody's involvement. The one point that I think I want to stress again, and I know several people said that, was how important it is that the county, as the public health agency, as the lead, to really take ownership of this conversation and make sure that hopefully everybody else understands that, again, that we have professionals that are doing a wonderful job. I know they've been working very hard, and I think as a community, we all need to acknowledge that they are the experts in this area, and we want to really take their lead in whatever we need to do to move forward and recover our economy. And then the only other comment is that obviously there's another communication subcommittee, and if you could please, anybody on staff can tell us a little bit about what the communication subcommittee is going to do, and is that going to be along the lines of what we talked about as far as the consistent messaging?
Let me answer that, Farhad. Yes, that's typically all of our communicators, public health, and kind of folks who are involved in information, and they'll be helpful in crafting consistent messages. What I think we, would like you to do is go back, and if you'd like to give us additional comments, feel free to email those to us so we have your comments. We can share them with others. Excuse me. We can share them with others and in your subcommittee group so that everybody sees what other comments are made. Our staff will, between John and Patrick and Diana, is summarize all the things we've heard here today and get that back out to you to see that, we've heard what you said and received a consistent message from you so that you'll understand that we're working through that. We'll try and do this as an iterative process and get that information to you in the next day or two. And at the same time, again, feel free to directly email to us, and I don't know whose email we're going to use, but probably John's, yours, or Patrick's?
Yeah, send them to, it's john.moffett@pima.gov.
And we can make sure they're shared.
Right. We are putting things up on the on this subcommittee web page, and you'll see more and more things starting to come up. As I mentioned at the beginning, we posted a number of guidance documents that are not necessarily they haven't changed, but there are so many of them. We felt that it was better to put it out there as a resource. In addition to that, for those of you that are online, one of the things that the county has done is we have generated a number of these kinds of what you see as a Stop the Spread of Coronavirus flyer. And we can make that available to you and your organizations or your members to put your own logo on and disseminate throughout the community just as additional comments. So hopefully that will save folks having to spend money with printers and that sort of thing to develop this. So the second one that just came up on the screen is the CDC Stop the Spread of Germs. So anyway, we're interested in trying to help you help your members or help your constituents. So if there are things like that that are of interest, please reach out to us and let us know what we can do to help there as well. Do we have any, for those of you, Farhad, I still see you have your hand up. Do you want to continue to speak?
No, thank you. That was from before.
Okay. Do we have any others that would like to add anything to the Randy Graff?
Yeah, just very quickly, I mean, it's going to be a challenge for the small business community in particular. I mean, after 8 weeks of shutdown and a lot of, concerns with the public that if you go outside, you know, there's dire consequences for it. So I am hoping that out of this committee and out of the county, some positive messages can come out there that there's a, you know, we can do this in a safe manner, good for the community. We've got to re-energize the business community. And I hope there's not mixed messages coming out of, you know, I've read something, as a matter of fact, on my way in here today from the University of Arizona that has concerns about the reopening at this time and that we should have stayed shut down. So I'm just hoping that we can all get on the same page with a positive message and image coming out of here from a PR standpoint to assist particularly the small business community and revenues to the cities and the counties, and obviously getting employees back to work.
All right. Chuck?
I think we share that same common goal. The issue is we are going to start to reopen, and so we need to do so safely and with the best possible public health advice we can use, and continue to do what we can do to stop the spread. This message is going to be hopefully very simple. Thank you.
One other thing that I would point out is that there is a communication subcommittee that is region-wide. Thank you. Yeah, we're all running out of voice up here. That's region-wide, and that group will meet as a subcommittee on Friday, I believe, but they will be staffing whatever comes out from the steering committee. So I think, you know, we've got a mechanism with this, within this task force, to also help consolidate and get a single message out, as opposed to diverse comments and messages. Any other folks online or anything that wish to make comments? All right, with that, I want to thank all of you for your time. This is by far the farthest reaching subcommittee. We cover a lot of area, but you also can in turn help us leverage and get back to the community as we start putting this material out. So thank you for participation, and I'll adjourn the meeting. Thank you.